Welcome back, everyone. I hope you got a little bit of a break, and I hope you enjoyed that video. I've watched that video, I'll confess, more than once, and it always chokes me up a little bit, especially when Paul Hewitt, one of our info line individuals, just said, "Hey, if you just want to talk, we're here. Give us a call." And it's amazing. We try as much as we can to add a human dimension to what can sometimes feel very inhumane with this disease. So, welcome back, everybody. As I said, I hope you had a little bit of a chance to stretch your legs, maybe get a cup of coffee here. For those of us on the West Coast, still a bit early. So, I got my cup of Joe with Dr. Joe. And now I'm just going to spend a few minutes. We've intimated it already, but talking about this concept of empowering individuals and communities to change the course of myeloma. I don't want this to be just a commercial for what we've done in Empower Charlotte, but hopefully, as we heard from Tiffany, being a bit of a template of how we can make a difference in a disease like this. And so, at the IMF, we've created our African American Initiative, which was really with a vision to improve the short and long-term outcomes of African Americans with multiple myeloma. And that's where we came up, as I mentioned, with this phrase empower or myeloma power. We're empowering patients to change the current course of myeloma. And I mentioned these earlier, but I'm just repeating them again purposely here to increase awareness around this disease and reduce stigma, provide quality education through this deep community engagement we've been speaking of, shorten the time of diagnosis through self-advocacy and indeed through educating the healthcare population, educating those who are caring for patients with myeloma with culturally competent or perhaps better now, culturally sensitive care, and really throughout the whole time support the myeloma community. And so wherever you are on the spectrum, if you've never heard of myeloma and you may have signs and symptoms consistent with it, if you know someone with myeloma, if you are a caregiver to someone with myeloma, we want you to be involved in this campaign that we have, and indeed in this long-term strategy of changing the course of myeloma, so that you know the symptoms, so that you speak to your physician if you have some of those signs and symptoms and may be consistent with myeloma, and see if you should be tested, and talk to others about doing the same. That one of the ways we've tried to build this community outreach is again, there's so many different things that we've done. But as we launched it in Charlotte a little over a year ago, we had social media campaigns and a press release. And really, in the essence, because so much of this was during the pandemic where we had to do it virtually as opposed to in person, we created a website, the empower.myeloma.org, where patients could come and participate in this toolkit, where we have videos that explain the basics of myeloma, that we have resources for individuals. You see here a picture of a woman down in the bottom corner, Tiffany Williams, who shares her story. She's both a myeloma patient and a nurse, actually, and where we have all these different resources available to you. We've had ongoing programs. I did a Facebook Live talking about what research is going on in health disparities. We're involved in the Black Health Matters Summit and so many other programs that we've been involved with. And as I mentioned, at the essence of it is this toolkit where you can find a support group, learn more about myeloma, understand it a little bit better, and indeed get very specific resources for caregivers, resources for empowering yourself. And, in a few minutes, I'm going to be talking to Robert about the importance of self-advocacy and your own well-being. Sometimes you can kind of feel like you fall into this bucket of being the myeloma patient and losing your identity. And we never want you to feel like you've lost your identity. And then some very practical things about drug reimbursement and financial assistance. All those drugs that Pete and I have talked about, we have to be very honest. They aren't cheap, and sometimes they can have a copay of significance, but there are often ways of overcoming some of that. And so we've tried to provide those resources to individuals. As I mentioned, here's Tiffany, where she can share her story. I really appreciated how the other Tiffany, our Tiffany here today, Tiffany Crank, shared with us the importance of storytelling and the importance of not just telling the story, but really sharing the essence of what you've been through, so that when people are going through this, they can see that they're not alone and they're not the only ones going through it. The other area that I've mentioned is because of this delayed in diagnosis, we've been really focused on primary care providers. So many of our patients, in particular our African American patients, have said, I had these signs and symptoms for a year before someone figured it out. And so we want to shorten that. And so I've done educational programs, and we've worked with multiple other groups. Right now, we have a large program with the National Medical Association, for example, and Black Nurses Association, to try and help people understand the signs and symptoms of myeloma and discriminate it, for example, from things like diabetes, so that they can do the right testing. Pete mentioned earlier that sometimes you can half test for myeloma. If I only look at half the crime scene, I'm not going to understand the full picture. And so sometimes certain testing has been missed. So we want doctors to order the right tests so that we can accurately diagnose myeloma and indeed facilitate a referral to hematologist oncologist. So to give you a sense of this, we created this tip card here that we distributed to thousands, literally, of primary care providers, where they could see what are the key signs and symptoms and what are the three really key areas of blood testing that they have to do to best diagnose this condition. And so this has been a big part of what we're doing to try and change the course of myeloma. But we've also wanted to influence the people who are caring for patients, both from a nursing perspective and a physician's perspective. And our International Myeloma Foundation Nurse Leadership Board published a paper for nurses. And indeed, we have one of the authors in our midst today, in Amy Pierre, who did a tremendous job in sort of setting best practices for nurses working in myeloma within the African American community. And we're doing the same now with a group of physicians. And we have several, not just to write a scientific paper, but to really try and educate our community better about how we can best care for patients with multiple myeloma. So here's the paper that Amy and her team produced, where they really spoke about so many areas of building trust, of engaging the community, of having a team that reflects your community, and of providing culturally sensitive care as we go forward. So when we think about Empower, it isn't just a Charlotte phenomenon, although Charlotte was really, if you will, our pilot and beacon center and continues to be that. But this is a program that we have been very much involved, not only in Charlotte, but really across multiple states and now multiple cities as we go forward. And as we look to the future, we're planning to include more and more areas as we will systematically work literally across the whole of the country, knowing that there are so many areas that require attention in so many communities. And as Tiffany shared with us earlier, no community is exactly the same. And so we want to go forward and help as many people as we can. To give you a sense, our Empower website has now had over 250,000 hits. So a lot of people are on this and are learning about this. Join us. Jump to that website even today, m-power.myeloma.org. Or as we've heard earlier in the video, reach out to us, call the info line, or go directly to our website. It is really our privilege to be able to try and help people on this journey in multiple myeloma. And we hope that you'll join us. So I believe, and I don't just say it in trite terms, I absolutely believe we can change the course of myeloma. I think we really can see a difference, and that some of this disparity that we've been discussing earlier can be reversed if we are all absolutely committed to it.